I invite Dr. Ravi to give a brief about today's scientific session.
So we will start this scientific session with a brief introduction about this particular machine which is now available in Trichy. So usually these machines are available as a single person machine. A single person can lie down inside the chamber, which will be closed, and then the atmospheric pressure will be raised, and then oxygen is delivered into the chamber for 1 hour. So this is for single person. The facility which is being inaugurated at Trichy is a facility where 3 people can have treatment at the same time. The patients can sit and they can have either a mask or a hood for them, through which the 100% oxygen is delivered, and then the chamber is in the higher atmospheric pressure. The atmospheric pressure is built slowly up, and then at the end of the session it is slowly brought down so that the complications of bubbling of the gas doesn't happen. So to explain all this, how the mechanism of action and the other things, I would request Dr. Taylor Sexton to start the session and brief us a little about the physics behind it, and then go to the cases. Thank you.
How are you all? It is a pleasure to be with you. Oh, is it a recorder? Good? Perfect. Thank you. Make sure that we're good. Guys, I am profoundly honored to be here with you all. Just to share with you while we get this up and going, just a little bit about me. As they said, I am the president of the American College of Hyperbaric Medicine. I've been doing hyperbaric oxygen therapy for over 25 years, 15 years as an actual physician, and then 10 years as a technician and a safety director in a variety of different facilities. I started to tell you my story, all those accolades, don't mean much if you don't know where you came from. And God has been so good to me. I was born at 28 weeks. I have cerebral palsy. I was told that I'd never walk, talk, or even be a doctor. I was thrown out in the U.S. because of my disability when I got much older, and I went to the Caribbean, and that's where I went to medical school. And the Caribbean brought me my passion for hyperbaric medicine. I treated over 1,000 dive accidents in my young career. So in my youth, I had the second most saves in diving accidents in the entire world, behind Duke University. And so it established me in a field that I fell in love with. Because not only that, as I experienced hyperbaric medicine personally in my own life with children with cerebral palsy and myself. And I'm also a pediatrician and an adult wound care and hyperbaric specialist with the American Board of Wound Healing. So I do adults and children, and I have treated every indication for hyperbaric medicine that is available. Not only the on-label indications, which we're going to talk about, but also the off-label indications. So I'm really excited. Is it working? Okay, 2 minutes. Well, then I'll kind of start. So what I want you guys to kind of know is kind of what hyperbaric medicine is and how to apply it, and realize that even though I only have about an hour, I will stay. Hopefully you guys are engaged. You're going to meet Dr. Sachi and Sasi. I hope I said the sirs. I hope I said that right. Good. Because they've used some incredible cases. And what I love about this in the room is the fact that we have a lot of orthopedics. Who's orthopedics right now? Because I don't want to offend everybody. Okay, good. Well, Dr. Ravi's my friend, so I won't offend him. Now, I kid. It's so nice to see orthopedics here, because most orthopedics in the U.S., I deal with the same thing. So when I come to India and I travel abroad and I get the privilege and honor of doing things like this, it's funny because people ask me, oh, how's it different? To be honest with you, your hearts and being open and the willingness to learn and to look at the evidence and to apply it to your patients, it's better here than it even is in the U.S. I have people, it's incredible to say that. I mean, and then I have incredible people like yourselves and partners in orthopedics that call me, hey, Dr. Sexton, we need this, this, and this, and we go, but then others are like, oh, it doesn't work. And I'm like, that's just not true. It's just not true. I had one orthopedic and general surgeon tell me it's a great job that I wasted in my life in hyperbaric medicine. Then he sent me, I just smiled at him. He sent me a patient he was going to amputate, and we saved their legs. Just to give you an example, and this is not to boast, but I have a 87% heal rate and a 90-day close rate of all wounds, meaning that we in the United States, we're judged and paid by our performance. It's called a MIPS score, if you guys are familiar at all with how we work. I know it's different. But if you don't have good scores, then you don't get paid. And so I have a very high score in wound healing. So the bottom line when it looks into hyperbaric medicine is I want you to know a couple things. There are, as Dr. Ravi said, two different types of chambers, a monoplace chamber and a multiplace chamber. And what we are doing is we are using pressure to apply pressure on the body so that they may heal. All right? And so it is critical that you have to use this specific machine. Are we close? All right, no worries. To bring healing to these patients. The thing that you need to realize, and what's so exciting, is that when you combine good education, and with the American College of Hyperbaric Medicine, we offer board-approved education. You're going to see a lot of it here, but there's a 40-hour course that people can enroll in. That, as I'm here to, obviously through Mr. Muley and Techna, you can get a hold of that. To educate you on hyperbaric medicine, and then there's certifications you guys can take that are board approved, that are U.S. and internationally recognized, so that you know that you're utilizing hyperbaric medicine safely and effectively. When you combine education with the right technology, you get the best clinical outcomes. And I'm here to tell you that not every hyperbaric chamber is the same. And the one that you're getting here in Trichy is that modular multiplace, where you can put more than one person in the chamber. Perfect. And that is going to really make a difference, because how you use the technology and what you're using is different. And I'm going to show you how it matters quite a bit, because chambers are not the same. And the soft shell chambers that you see, that's a very much a perversion of our society and our specialty. The lower pressures do not give the application of hyperbaric medicine that's necessary. You must go at higher pressures, that at 2 atmospheres to 2.4 atmospheres, to bring healing to these patients. Now, how it works is hyperbaric medicine, it supersaturates the plasma. So you use pressure, and if you go back to physics, Henry's and Dalton's law, when you increase the pressure, you increase the saturation or the availability of oxygen in those tissues. And how that works is, if you think of it, most people, as you said, if you think about hyperbaric medicine, what are the indications? Most people just say, well, diving or chronic wounds. They don't really know anything else. But in this case, the whole point is how long you're at pressure and how deep you go, it loads the oxygen into your tissues. And that's what's important. Oh, yeah. Almost. That's all right, I can use this. I do it like that. All right, so here's what I want you guys to know really quick, is this is not hyperbaric oxygen therapy. This is very much, a lot of people assume that as long as you just put your limb in a bag of oxygen, that's the same. This is transdermal oxygen. And there's very, very few places where transdermal oxygen will actually help. Now, it will help for wounds. Like if you have a wound there, it will kill mild bacteria and things like that on top of the wound. But this is very much a fallacy of what hyperbaric medicine is. It does not work. You must use a specialized chamber. You must breathe oxygen into your pulmonary system, right, as a drug to bring oxygen. So the topical oxygen therapy that you just saw does not work. And that's not hyperbaric oxygen therapy at all. And so you must use a hyperbaric chamber for that. Still technical difficulty. Sorry, guys. Have to do it this way, huh? Okay. All right, so what is hyperbaric oxygen therapy? Like I said, it's where you breathe 100% oxygen under pressure, right? Now, the treatment can either be carried out in a monoplace or multiplace chamber. If you ask me officially which one is better, so the therapeutic benefit, either one, a monoplace or a multiplace, will give you the effects that you're looking for clinically, right? But in terms of safety, which one is better is like the one you're getting at Trichy, the multiplace chamber. So again, you must inhale 100% oxygen into the patient's body under pressure in an enclosed pressurized environment. And that is going to give you hyperbaric oxygen therapy, or oxygen under pressure at 2 to 3 atmospheres to deliver oxygen to the hypoxic tissues. And it reverses hypoxia. It loads oxygen into the tissue. It promotes angiogenesis, or grows new blood vessels. It heals wounds. It creates microfibroblast or fibroblast activation. It remodels collagen, and it will heal things that otherwise couldn't be healed. And it will kill bacteria. in a variety of ways, particularly in chronic bone infections for your orthopedists and so forth. So how does that work? In normal baric conditions, or in the area that we're breathing right now, the air that we're breathing has 21% oxygen and 79% nitrogen, right? And when you increase the pressure with Dalton's law, you double and triple the amount of oxygen available to the body. All right? And what happens is when you look at an injury of any kind, whether it's a burn, whether it's a wound of anything, you have a normal baric zone of where oxygen can get to the tissues, which is only about 64 microns into the body, right, throughout the process. There's still a zone of ischemia, or where there's hypoxia, particularly in diabetic foot ulcers, in burns, in osteomyelitic bones, for example. The usual osteomyelitis, the oxygen tension in osteomyelitic bone is about 20 millimeters of mercury. And your white cells, for example, the phagocytes and leukocytes cannot function unless it's 45 millimeters of mercury or higher. And so hyperbaric medicine can increase this and give you a diffusion overlap of oxygen, meaning that you have the ability for more oxygen to be delivered into the tissues and thus cause healing. So it goes between the arterioles and the veins, and it permeates the plasma. So in this case, you don't need your blood supply because oxygen is everywhere in this case. Okay, so this just shows you a schematic against what normal baric and how much more oxygen is available inside the hyperbaric chamber when you're breathing. Now, like I said, you're getting the one at the top, that top left right there, that the modular multiplace. But we have, like the one at my center, is a large 8400 that holds 12 people. And the multiplace and monoplace, those are the differences. And the monoplace holds one person. But remember, the one on the right there, that soft shell, that's not hyperbarics, right? These low mild hyperbaric chambers have no clinical benefit except for altitude sickness. And they're, like I said, a perversion of our industry because they don't work. And people say they're doing hyperbarics and they're not. So I'm really proud of Trichy and to be here to talk about true hyperbarics. So what are the approved indications of hyperbaric medicine? There are over 15 to 17 approved in the United States. There's over 35 in Europe, and there's up to 60 in China and Japan. So, you know, there's a lot of things we can do. We're going to talk about a lot of these. I'm going to go through a lot of clinical cases and try to go through, and I'll go kind of fast at the end. I know I have about 45 minutes, and I want our sirs to be able to give their cases. So I'm not going to go into some of the things that they do because obviously they have cases as well. But there's a lot here, and as you guys can see from the list, a lot of these you guys will see, and it applies to orthopedics and ophthalmology a lot, but orthopedics a lot with diabetic foot ulcer, with chronic osteo, with crush injuries, with compromised grafts and flaps, and a bunch of things. And then we're going to talk about a little bit of what I would say, I don't like to use the word off-label, but research-based, because in the United States, Crohn's disease, traumatic brain injury, cerebral palsy, autism. I have miraculous stories of these kids, adults, that couldn't speak that are now speaking. And so we're going to go through a lot of that. Now, what does hyperbaric medicine actually do? So what it does is it diffuses oxygen into the body, right? It forces oxygen into the tissue. It suppresses certain toxins like gas gangrene. It kills Pseudomonas. It kills Staph aureus. It enhances leukocyte-dependent killing, right? By increasing the oxygenation, it helps with oxidative burst. Okay? It decreases adhesions of white cells. So when you get the occlusions or lack of blood supply, that's hyperbaric medicine can actually help mitigate that. It vasoconstricts normal vessels. So it actually, when you have oxygen, too much oxygen somewhere, it stunts it and it vasodilates where you need it. So in a diabetic foot ulcer, in the bone, it pushes oxygen into the tissues that are hypoxic. It produces, people ask me a lot, well, oxygen is a free radical, right? It'll hurt you, right? So they say too much oxygen. So although that's correct in the scientific community, what hyperbaric medicine does is upregulate the antioxidants, superoxide dismutase, catalase, glutathione peroxidase, so you cannot get reperfusion injury with hyperbaric oxygen therapy or oxidative stress. Matter of fact, hyperbaric oxygen therapy reverses reperfusion injury because you can hyperoxygenate the tissue. And the problem with reperfusion injury, as you guys know as surgeons, when you reintroduce blood or oxygen to the tissue, you have damage to those tissues, right? Because it was devoid when you have to use a tourniquet or whatnot, and then you reintroduce, and then tissue damage occurs. In hyperbaric oxygen therapy, that doesn't occur because oxygen is already there, and it stops the oxygen-free radical damage. It preserves ATP. It enhances ATP. This has to do a lot with stroke. And the big thing here is it reduces inflammation and edema, both in the compartment syndrome level that you guys deal with in orthopedics, in the surgical level, and also in the brain and everywhere else. So it's a massive edema reducer, an inflammatory reducer. Okay, it helps with necrosis of the brain or encephalomyelitis of the brains, and we do a lot of radiation necrosis of the brain for our orthopedic colleagues. If you remember anything from this slide, is that it does two things. It promotes angiogenesis or new blood vessel growth or nervous pathology. So it can actually reverse some diabetic neuropathy, or if you have ulnar nerve damage or certain nerve damages that have been especially traumatic, it can help regrow those tissues, right? Now, again, there is oxygen does have some mild side effects, but what I want to take away is that it's extremely safe, and the only time that you're going to see any sort of side effect with oxygen is going to be maybe with seizures, but that only occurs in less than 1/100 of a percent, 0.1%, and it only occurs at the depths of 3 atmospheres or deeper if you're a normal person, like any of us, if you don't have a seizure disorder. If you have a seizure disorder, it can occur at 2.4 or less, only if you're not controlled, and it's very rare. Like if you have a fever, and you haven't taken your seizure medication, then it lowers the threshold. Otherwise, it's extremely safe, and there's ways to do it. So just because you have a seizure disorder doesn't mean you can't do hyperbaric medicine, for example. So it is extremely safe, and we'll talk about that. So it reduces blood flow from hyperoxic areas. It improves blood flow to hypoxemia areas, and it improves bone repair and tissue salvage. Right? It helps with burns, nerve cells, and soft tissue radiation necrosis as well. So again, we call that the Robin Hood effect, where it robs from the rich and gives to the poor. So your body does a good job at stunting at places that need oxygen. It gives oxygen to the places that need it, and it keeps it where it doesn't. Right? It increases healing in hypoxic wounds. Without it, you wouldn't receive healing that you normally would with these wounds, and it stimulates angiogenesis and neurogenesis. So let's look at some cases. Here's a great case. This is a 16-year-old that had necrotizing fasciitis, who initially, 24 hours before this, did not have anything wrong with his foot, came in with cellulitis, and then you had these significant wounds. He had Vibrio from standing in free water. The patient had IV antibiotics and 20 treatments and was completely healed. This patient was an uncontrolled diabetic. Most orthopedics in my world, in the U.S. initially, would have said, let's cut this off. There's no hope, right? You can see obviously some necrosis. You can see tendon involvement, and they said, nope, we just need to cut it off. The patient's daughter was adamant that please, before we do an amputation, would you please try? I tell a lot of my colleagues in the surgical world, hey, if I'm wrong, you can always cut it off. You can never put something back on after you take it off. So give me a chance. Refer to us, let us do good wound care with hyperbaric medicine, and then you can cut it off if you need to. And I don't mean that to be facetious, because I don't want that to happen. Hyperbaric medicine is all about limb salvage, right? That's the big thing. And I'm also not telling you that sometimes your patients may need some sort of amputation, a transmet and so forth, but I am telling you that sometimes I can avoid it completely, and sometimes I can avoid amputation to a severe degree. So I used hyperbaric oxygen therapy and some negative wound pressure here, and in 3 months, this is 5 months, excuse me, we are completely healed with no graft, no flap, anything. Complete healing. So now, when you look at pressure ulcers, hyperbaric oxygen therapy can help with a lot of bed sores and pressure ulcers, particularly because these patients have chronic refractory osteomyelitis, and we're going to talk about what that looks like here. So if you look at the evidence behind pressure ulcers in stage 3 and stage 4, right, if you add hyperbaric medicine alone with standard wound care, you can have a 60% chance of healing it faster with nothing else. And it's about 20 to 40 dives a day for 90 minutes, right? And as you can see, over 60% showed full or substantial healing. Now on the other side, the Cochrane review there is if you have hyperbaric oxygen therapy with chronic refractory osteo, you can see up to 90% healing with that in these chronic wounds, and I'll show you some cases there. So again, hyperbaric is approved for chronic osteo because when you have a lot of these, in this state, you do a lot of IV or PO antibiotics, right? And the evidence shows that you need at least 6 weeks. Well, most of a diabetic or a chronic osteo, they always have associated osteomyelitis. The antibiotics don't penetrate the wound as effectively. Hyperbaric medicine has synergy with antibiotics. They work 20 times more effectively, especially with the aminoglycosides and so forth, because those use oxygen to cross the cell wall. And the big thing you want to take away is the osteomyelitic bone has an oxygen tension that's 20 millimeters of mercury. It's very, very hypoxic, so it's not going to heal. But where a normal bone has 45 millimeters of mercury, when you use hyperbaric oxygen therapy, it triples that. So it's in the hundreds, and that's why it can heal so well, one of the reasons. So here's some evidence. When you look at utilizing hyperbaric oxygen therapy with refractive osteomyelitis in adults, if you do from 1965 to currently right now, 2024, there's over 201 articles spanning this period, and it all supports hyperbaric oxygen therapy, and we're going to go through a couple. So a Torayan group took 44 spinal cord injury patients with osteomyelitis secondary to pressure sores, and they did just hyperbaric oxygen therapy with debridement, no IV antibiotics in this one, and they showed a 68% heal rate with just debridement and hyperbarics, which of course we know we should be adding antibiotics as well, but they did an arm of that. Another group, more definitive data, Moray did 40 patients. They did hyperbaric oxygen with IV antibiotics, debridement, and saw resolution in 75% of those patients and continued healing after 7 to 10 years. So this is a permanent thing. When you grow new blood vessels, it lasts. Here's another one. You have 38 patients here, 45 treatments on average, and you had about a 90% heal rate. So on average, all of your patients need about 20 to 40 treatments to achieve healing, especially when it comes to chronic refractory osteomyelitis. So it is a time commitment for your patients, but if they can commit to it, they'll avoid amputation, they'll be completely healed. All right, now here is in cases that we had done personally in pediatrics. All of these cases were 10 to 18 years old, and they had injuries, and they also had some spina bifida or cerebral palsy with it as well. And I wanted to show you that not only that, you see a reduction in CRP and ESR. So you can look at this schematic, and you can see that on the medical condition, spina bifida, or they may be normal, but some of them are paraplegics. Most of your osteomyelitis too, as you guys well know, CRP and ESR can be elevated, but remember that 8% of the population can still have osteomyelitis and have a normal inflammatory marker. So just because a lot of my colleagues in orthopedic in the US say, oh, no, their inflammatory markers are normal, they don't have osteo. That's not true, right? It's just not true. They can have osteomyelitis. They do have osteomyelitis, and you can confirm it with imaging, or you can tell if you have a really spongy bone or a soft bone, they have osteo. So I just showed you a cool schematic here that's pretty staggering. The line in the middle shows you where we started hyperbaric medicine and what the ESR was when they first came in, and then when they refract or stagger back up, and at the end. And the CRP is even better. That is very, very compelling. You can see where they started. When we did IV antibiotics and just debridement, the wound wasn't healing. The CRP spiked, showing the chronicity, and by the end, done there. So there's one of our patients. All right, so again, the protocol is 2.4 atmospheres, 2.5 for 90 minutes, once a day for 30 to 45 treatments on average. And sometimes you guys can get away, but at least do 20. 20 is the minimum for angiogenesis, right? So if you talk to your patient and they're doing dramatically better, as long as they do 20, it's okay if you kind of fall off there, but you really need to try to get in that 20 to 40 sessions depending on clinically and if you look at the evidence there. All right? So crush injury, this is one I'm very, very proud of. I'm not going to go into it because our colleague Sachi has a lot more of this, but I just want to show you one case, and I won't go into it too much for him to talk about, but the bottom line is it helps with reducing edema and inflammation and keeps tissues viable until you can do it. So this is a case that we did that I'm very proud of in pediatrics. It helps reduce swelling in the vasoconstriction piece, helps with compartment syndrome. It kills infection, particularly anaerobic infections and staph and so forth. And it helps with killing and neutrophilic killing. So this is a pediatric patient, a 4-year-old boy came to our facility who was run over by a lawnmower, right? At the time of this injury, it was over 10 hours that he had this injury. So everybody would have said, this limb is gone, right? It's dead. It's been detached like this for 10 hours. You should just cut it off. Well, they consulted us because we have an incredible, because I'm part of a hospital system. The orthopedics and vascular did their diligence in the OR, and they put him in a Lizeroth or fixator. And we started hyperbaric medicine immediately. We started 3 times a day, and then twice a day, and then once a day. And you can see, of course, still some swelling, but you can see the viability of that tissue. And at the end, the child was able to heal and had no need for anything else, right? So that's pretty cool. So this is another one, another lawnmowers in Mississippi and Florida. I have a center in Mississippi as well, but lawn care, this is a flap and a compromised flap. So debridement, put them in hyperbaric medicine. Now, the big thing about this is you guys well know, especially my surgical colleagues, what's the big danger here is your constrictures, right, and movement. Because after you do something like this, after he heals, he may be stuck like it's locked, right? And hyperbaric medicine reduces edema and helps with that. And you can see he had hyperbaric medicine, 20 treatments, and has full range of motion, no constricture. And hyperbaric medicine will help you do that as well. Now, if you look at compromised grafts and flaps, does it have a role? Does it apply? And the answer is yes. Yes, it does. And you guys do a lot of flaps in your practice as well because you require those things, right? So hyperbaric medicine, when it looks at grafts and flaps, remember that grafts are pieces of skin that you put on tissue that do not have oxygen, right? They rely on diffusion, and the problem with diabetes or other things with microvascular disease, there's not enough vasculature there to support the graft, right? So you need hyperbaric medicine can support the graft, keep it viable, and not die. Flaps, of course, you know, takes blood vessels with it, right? So you have to anastomose and put them all together. That's a highly technical procedure, but still, you may think it's better because you have blood supply, but they can still fail, and hyperbaric medicine can keep those viable for you and promote new blood vessels. Now, again, the big thing I want to take away from here is obviously when you have other comorbidities like peripheral vascular disease, cardiac disease, diabetes, they're not going to heal as effectively. The takeaway here is if you get them into hyperbaric medicine and you think you have a failed graft, you have a chance to save your surgery 90% of the time, and that's evidence. All right, so I'm not just making that up. That's 89% of the time. If you institute hyperbaric medicine, at the moment that you see it start to fail or be in question, you can save your patient's sight, which saves you money and time. Right? Here's an example of some of our centers across the United States that we do. And so flaps fail. When they fail, they're very expensive, and we can help heal those. So again, here's the study. If you get them in, and if you get them in early, the earlier you get them in, the better they're going to do. But even after, you can see about an 81% heal rate. And I can share these slides with you. Mr. Muley has them and so forth, so you can see that. The protocol, this is an older protocol that we have adapted now. It's just an older schematic. You can do it a variety of different ways, either 30 minutes with a 5-minute break, 30 and then 5, or you can do 45 minutes on oxygen, 10 minutes on air, and then 45 minutes. There's a few protocols you can use, but the depth is what's important. Right? So it's between 2 to 2.4 atmospheres. For this protocol, for all of your wound care treatments, right? You're going to use it really for diabetes, for osteo, for flaps and grafts and all those. It's the same treatment. That's what's nice. You don't have to come up with 5 different treatment protocols. All your patients get treated the same way, the same time, every way, with the great outcomes. And we can share those with you with the American College. And these are available online as well. So if you look at the best, when it looks at a flap, flaps typically can be healed within 20 treatments. So it's a very quick protocol, about 2 weeks, a little bit more, but 2 weeks for the sake of this conversation. 2 weeks, once a day, and you can heal them dramatically, and that's what's nice, and it can salvage your grafts and flaps. So let's look at diabetes. You guys are well known to this, and you know that when you have a diabetic foot ulcer, particularly after an amputation, your mortality goes way up, and it even beats other mortalities such as cancers. You have a higher risk of dying after an amputation from a neuropathic wound than you do with other things like cancers and so forth, which is extremely sad, right? I want you guys to take this away from the surgical and wound care standpoint. A key indicator that you need to employ hyperbaric medicine is this. You should expect in 4 weeks that a diabetic foot ulcer, if you're doing standard wound care, should heal by 50% in 4 weeks. If it does not, you need to start hyperbaric oxygen therapy, right? It's critically important. Venous leg ulcers, the same way. You should expect 40% healing in 4 weeks. If it doesn't, start hyperbaric oxygen. And then a pressure or surgical or traumatic wound averages about 10 to 15% per week and should be healed. Now, obviously, you know that the diabetic foot ulcer is a chronic issue. And what's amazing is, I just looked the stat up, India beats the United States, which boggled my mind, which of course I knew. But by 2025, you guys have even more incidents than we do, and we're rampant, right? So I joke that if we could all not, if we ate right, if we didn't smoke, we didn't drink, we'd be out of a job, right? It's job security. But all jokes aside, the point of this is most of a quarter of your patients have amputations because of diabetes. If you employ hyperbaric medicine with your patients, you can heal these wounds 60% of the time. And that's the evidence. Of that 60%, or I'm sorry, take that out. If you look at me and say, well, Sexton, you still have to have an amputation. You still have to do this. That may be correct. So take 60%. Of that 40%, that require amputation, you can reduce the amount or staggering severity of the amputation by 80% if you use hyperbaric medicine. Meaning if you thought that you were going to cut them at a BKA, like below the knee, right? It may just be a transmet. So it's extremely powerful. And these are a couple studies that go along with that, showing 2 times more likelihood of healing than without hyperbaric medicine. So you have about a 30% chance to heal without them in a year, right? And then a 52% if you do it with a year. This is one of those examples where still had an issue, osteo with a compromised flap continued to worsen, healed within just 27 treatments. Intracranial abscess is another big one. Obviously, this crowd doesn't do too much of this, but this is a 12-year-old boy. Intracranial abscess is an approved indication for hyperbaric oxygen therapy. You can see the abscess there, and all he had was IV antibiotics and hyperbarics because the neurosurgeon couldn't drain this abscess because of where it is. Functional, he wouldn't be functional afterwards. So we did hyperbaric medicine, and just 10 treatments healed the abscess. All right? We see this a lot. I'm going to go through some stroke and things as well. It reduces glial scarring. It helps with concurrent osteomyelitis. We see a lot of skull osteomyelitis, a lot, and flaps and grafts after implantation as well. So let's look at some things with stroke and some motor functions. Stroke is extremely, it's a newer indication. This works dramatically impressive with ischemic strokes. Of course, anything that I say, the sooner you get them in, the better they're going to do. But also, the penumbra of the brain, which is Latin, penumbra means the area around the brain for the insult, stays viable for 7 years, meaning that if you can get them into hyperbaric medicine, you can avoid or reduce ischemia, reduce inflammation, and they can see improvement in their body and movement. And here, if you look at this, hyperbaric therapy was a safe, effective practice that actually helped move his limb and functionally recovery of his limb after a stroke. Fibromyalgia is another big one here that we deal with a lot of chronic pains, diabetes or beyond, and just in general. If you use it for this is a very safe and effective way to reduce and improve, reduce symptoms and improve their quality of life because it promotes neuroplasticity and grows new nerves, new nerve pathways. And so there's less pain and less medication needs. So it offers significant improvements. Sports medicine, what I love and what I love about this orthopedic group too is when you're doing a hip replacement, a knee replacement, a shoulder, any of these things, they're going to do better, right? I'm just adding that in before I go into sports medicine. The reduction of pain, I do a lot in my center. They come in and they say, I'm about to have a new hip, a new knee, or they come right in and we do 10 treatments and they're back at work faster. They're improved with their physiology or their physical therapist, and their outcomes and their healing rates are much, much better. And we just do 10 to 15 and they are running around the room. Sports medicine here, when you look at early recovery for a myositis or rhabdomyolysis, for example, if you have a highly functioning athlete, you put them in the chamber for 5-7 treatments, and they're completely improved. So early recovery in your muscle injuries there. So neurology. So the big thing here, and it is important for you guys to know if you ask yourself, well, why are we talking about this and this? Not only just to expose you, but to let you understand that it helps with tissue edema, particularly in the brain. It upregulates ATP. It helps with neuroinflammation and angiogenesis, and that's why it works so well in this. So if you look at strokes again, like we said, you can see improvements in all cognitive domains when it comes to stroke and late chronic stages. I can tell you personally, if there was anything out there in my own mother, which I've treated my mother, she has stage 4 colon cancer. She almost was going to, orthopedic wanted to cut her entire leg off, and all she lost was the tip of her toe. But she also suffered a stroke because of the hypercoagulable state. We put her in hyperbaric medicine, and she's completely normal today, and she's 60 years old. So you can lead to significant neurological improvements with stroke, even at chronic stages. Neuroplasticity can still be activated, even with the onset of damage, and we can see some incredible potentials there. Traumatic brain injury is the same way. Traumatic brain injury, I have a passion for because just like cerebral palsy, the only difference with cerebral palsy is mine happened at birth, whereas traumatic brain injury happens when you're older or whenever you have the trauma, right? But it can happen when you're older. So it reduces edema, it promotes angiogenesis, and it can help reverse the symptoms and cause improved neurocognitive improvements. So these are the studies. I'm just going to go through here with you. Cerebral palsy, just a touch of mine really quick. We see this a lot. I have noticed in India, this is a very underserved population. I've had the privilege of traveling to different cities over the course of being here. This is my second trip, but I usually stay for 10 to 14 days and be at different cities. And I am impacted positively by a lot of individuals, but I know that if there was more access to hyperbaric medicine, especially earlier on in their young lives, they could have reversals, and you can see them benefit. If you look at the Academy of Pediatrics, it improves gross motor function, it reduces spasticity, and it improves quality of life. And for me, the bottom line, obviously, I still have cerebral palsy. Obviously, I'm still what I am, which is giving me my passion for people. I'm not ashamed of it. But if you tell people, it's not going to cure them completely, but it is going to change their life and make their life better. It is not quality of life what we're trying to do, right? And that's the point, and that's what I want you guys to get. And there's been numerous studies, both from 2020 that you saw before, all the way down to 2001. So this is not new, and that's what I wanted to show you, that we're not talking about, I'm not using old studies in 1965, but I'm also not using, and I'll use new ones, but I want you to know this has been around, and we're just not using it. And now for us to be in this room to start utilizing it for anything is a big deal. And that's actually me. As a child, just to give you an idea. So, like I said, reduction spasticity and improvement of quality of life. Autism is the same way. Like I said, later CMEs, I will talk to you guys until I'm blue in the face about all this stuff. But autism, just in general, is a multifactorial issue. But this is kind of your reasons behind autism: oxidative stress, neuroinflammation, neurotransmitter issues, and hyperbaric medicine can help greatly. Again, it helps with CRP, protein levels, motivation, speech, and cognitive awareness. All right. So again, many things. Sexual disorders, especially erectile dysfunction, is also one that hyperbaric medicine, has been known to really help. And the reason I bring it in, again, not so much in our bailiwick, but individuals that are coming in, especially males that are struggling with this. If there was a way for us to say, especially diabetics, and if you have prostate cancers with radiations and things like that, they deal with this. And if I could save my function, if that happened to me, I'd want to try. And this is evidence that shows you that it improves peak flow rate and vasodilation of that penile gland, so you're able to continue sexual function. Now, thermal burns, this is a great one. I'm just going to show you this. Usually you have a lot of zone of declaration and worsening, but here's a case that we're very proud of. A young child, she's about 16, that happened. She spilled herself during Thanksgiving. 3 days of hyperbarics, just 30 days total, no grafts or flaps, and there she is. So delayed radiation necrosis is one that we see a lot. If you have a lot of concurrent patients with your cancer colleagues, that's why I bring this up. It's extremely important. It happens a lot. It happens here in India. It happens in the US. About 40% of my population in my clinic is just radiation necrosis, whether it be ORN of the mouth or teeth for the dental colleagues, or actual tissue radiation with proctitis, cystitis, and things like that. It promotes angiogenesis. Grass won't grow where there's no water, right? Same as that. Things won't heal without blood supply. Hyperbaric medicine will grow that new blood supply and keep these viable. And here's some great cases. On the top, you'll see a breast from breast cancer that was irradiated. And this can happen within 6 months to years. 10, 15, 20 years down the line. I'm sure you guys have probably seen it. And this was able to be done just with healing. And then we have another one with squamous cell carcinoma of the throat, and we have complete healing there. Here's one we're proud of, very proud of a hand. Again, this was just basic wound care in hyperbarics. That's what I want you to know too. These wounds, a lot of people are like, what can you do? Not much in wound care because there's no blood supply, right? That's why hyperbaric medicine is so important. As long as you get oxygen there and then they grow blood supply, they will heal with good dressings. Radiation cystitis, the same thing. I'll just show you one slide. You can see all that. It doesn't pixelate very well, I'm sorry, but you can see on the left a lot of bleeding and some clots and 20 treatments of that. I see a lot of this completely healed. Same thing here with cystitis. You can see the improvement. There is a ton of evidence when it comes to radiation cystitis. As you can see, that if you put them within hyperbaric medicine, within 6 months that you notice the injury, right, that you notice the injury, you can have up to an 80% to 90% heal rate. So this is one of those, I tell you, if you have colleagues in oncology and so forth, and these patients are dealing with it, to get them on board, and they'll do dramatically better. This is a study that we did. Actually, my wife and I, my wife is a pediatric critical care doctor, but she did some early to help me. She helps me in the clinic as well, and with some of the stuff. And we did 76 patients just this was earlier on. We took 76 patients with soft tissue radiation necrosis, and we looked at pain particularly, just quality of life and pain and things that they deal with delayed radiation injuries. And our sample was, we had a lot of prostate and rectal, we had some mandible and skull, we had some breast and vaginal radiation injuries, and then we looked at trunks. So this is the breakdown of it. And you can see that about 70% of our patients experienced significant reduction just in pain. So as a pain or just a pain motivator, they came off of morphines and chronic pain medications just with hyperbaric medicine alone. And overall, 83% showed an improvement in their specific pain, whatever they're dealing with. And that's a pictograph. You can see their scores were really in the high, 5, 6, sometimes 7s. And at the end of hyperbaric medicine, they were sitting at 2s, basically, which is very, very good. Right. Now, if you look at soft tissue radiation injury, this is the data in the United States, but you can see that about 30,000 per year, and you've got about 100,000 about a little less than 1 million people that have radiation injuries. So there's a lot of people out there that can be benefited. I know here in India, there's just as many. Sudden neurohearing loss is another one for our ENT colleagues. These are where the hearing loss is just sudden. They have no idea what happens. Sometimes it's a viral trigger. Sometimes it can be a overexpansion injury of some kind. But this is where you have nothing to do. When they fail oral steroids, because all the ENT does is give them oral steroids, or sometimes they'll do TM injections of the ear. Sometimes about 5 times. But most of those times those fail. You put them in hyperbaric oxygen therapy, and you can have about 65 to 75% salvage or complete restitution of their hearing. So if I was going deaf on one side, I'd want to do hyperbaric medicine. This is one of those things that makes a big difference. Ideally, you want to get them in as soon as it happens, kind of like with central retinal artery occlusion and RP, retinoblastoma pigmentosa, that Dr. Sassi will speak on. You should do it as early as you can, but I want you to know that don't ever think in this crowd that, oh, it's too late. It's too late. It's not, right? The more you get it on time, and I will begin closing with this, and we'll open with questions for me, but also at the end, whatever questions you have. Hyperbaric medicine is all about being adjunctive, meaning that I want everybody to look better. I love what I get to do when I speak to people because I want my orthopedics to be the best surgeons they can be, my surgeons to be the best, my ophthalmologist, my cancer doctors. We don't need the praise, right? But not utilizing hyperbaric medicine in your clinical practice is, I mean this with all humility when I say it and not to sound mean, is foolish. Right? It's a tool in your toolbox. You can't build a house with just a hammer. You need other tools. And this tool can dramatically impact your patient's outcome, and it will change people's lives. And that's what's so exciting. Here's one with Crohn's disease. This is a real-life Crohn's patient. When they fail immune biologics, they're in immense pain. You have a lot of fistulas. You can see the obvious fistula, a lot of mucosal inflammation there. And I've done many, many cases with Crohn's. That will be probably a new indication that get approved in the next year or two. And you can see, look how beautiful that intestine looks now, same area. So it will completely heal wounds. This is a anorectal fistula. You can see the Penrose drain there. And then one at the bottom completely healed. Because the problem with these is you can't get to them, right? There's no surgery, nothing. You can't do anything. So only hyperbaric medicine can touch these kind of wounds. I'm excited here because we do this a lot in Florida and Mississippi is snake bites, but you guys have a ton of these, and in the orthopedic world for compartment syndrome, I know I saw a cobra in the tree the other day with Mr. Muley at his place. So you guys see this a lot. I love snake bites. It's one of the things that I do subspecialty in hyperbarics. I get a ton of snake bites. This is one that we did on a 14-year-old male. After he did crowfab, he got discharged. He had no range of motion of his leg, and he couldn't move. He was 8 days in the ICU. Then they consulted us, and we did only 5 treatments. We did a few more. We did 10 in total. But in this patient, we do an average, of 5 to 10. This patient did 5, but all you need is 10 treatments for your snake bites, so it's very short. And you can see how much edema and swelling of that left picture is, of that knee. And you can see at the end, full range of motion and reduction of swelling and back to complete normal. So again, limb salvage. Here's another one with a Berger's vasculitis. Anything with critical limb ischemia, guys, with if you do an ABI or if you have a patient that's got a crush injury or critical limb ischemia, hyperbaric medicine can reverse. This is one with a critical limb ischemia of his tips of his fingers. The surgeons wanted to amputate, particularly that 4th and 5th digit. Hard to see on these photos because it's not coming up in full screen, but they were going to do an amputation. The family said no, so they consulted us. This is the protocol we used, and you can see a pre and post, how much more viable those tissues are and how red, and then of course it reduces his pain, and he had full range of motion and didn't lose his fingers. So again, hyperbaric medicine offers an essential way to enhance the body's healing, and it will help you improve. Now this is going to be the last few slides that I do before I turn it over to my colleagues. Sorry that you guys can't see this, but I wanted to give you a lot of other indications as well. Let me see, yeah. So Lyme's disease, I know you guys don't see that a lot, but Lyme's disease and refractive Lyme's disease is another great indication. Multiple sclerosis, fibromyalgias, but there's a bunch of data and research that you guys can have that's been clinically vetted that are good studies that can show you that this helps. So there's a ton of evidence of what hyperbaric medicine does. And the bottom line is hyperbaric medicine supports healing by hyperoxygenating, reducing inflammatory effects, promoting mitochondrial support, and then regrowing these vascular pathways. And it is a privilege. And there's a ton more, and I look forward to working with you guys. So thank you all. And we can either, however you want to do it. I don't know, Dr. Sachi and them. Are we doing questions before or after, Amelia? After. Good. Perfect.
Thank you, Dr. Sexton. It was a really wonderful session. So we saw a lot of indications. So some of them are already approved. As you said, some are approved in USA, more are approved in other countries like China. So then he was saying about seizure. I think we should include the history of seizure whenever we start treatment for a patient. We should know about the history of seizure and the medications. So we should include it in our protocol. And then about how to reduce, some of them were asking if it is going to be 30 sessions, 40 sessions. So if the patient he cannot afford and then he wants to stop at 20 sessions. So here is where our biologics come, orthobiologics come, where by adding platelet-rich plasma or stem cells, we can reduce the number of sessions. One more small point which I wanted to add is angiogenesis is coupled with neurogenesis. Please understand, angiogenesis is coupled with neurogenesis. Wherever you see an artery, vein, a nerve goes. In the body, you can see everywhere an artery, vein, and nerve go together. So, whenever we give all these orthobiologics and other things, when angiogenesis happens, in the same tissue, neurogenesis also happens. And I will explain this later.